Duran from BSN1 Section 11N from Davao Doctors College. I am here to perform and demonstrate general survey and nursing interview. Nursing interview is done to determine the client's current health status by obtaining subjective and objective data in order to formulate an effective nursing diagnosis and appropriate nursing interventions to address abnormal findings noted from the client. So, review the client's previous medical records if available. Reviewing patient's medical record offers the opportunity to identify instances of harm to a patient and to undertake quality improvement to improve patient's safety. Second is prepare necessary treatment such as the hospital comprehensive health assessment and pen for taking note for the client's data. Doing this will save time and the assessment will go smoothly. Third and lastly, perform hand washing. I have done thorough hand washing earlier. And seems like there is no any sink available in this place to perform hand washing, so I'm just going to use alcohol for my hand hygiene. And since I already did have doing an alcohol, this is done to determine spread of microorganisms. Greet the client politely and the client's companion if allowed. So, hello, please take a seat anywhere you feel comfortable. And welcoming the client and significant others can help them feel at ease and less frightened. Introduce yourself and verify the client's identity. So, I am Joanna Duran, and I am your student nurse for today. And you are?
My name is
And as the client would like to be called during the assessment, how would you like me to call you? It's best to ask because clients from different cultural backgrounds may have a certain expectation about to address one another. Explain the purpose and objective of the interview, the type of question to be asked, and reason for taking notes. Sir Peter, I am going to conduct the interview, particularly asking some questions about your health, status and medical background, as well as your personal circumstances for me to help you with your concern. In addition, your answer will be documented and the data will be gathered, will remain confidential. Would that be okay to you? Thank you. This because explaining what to do reduces apprehension and facilitates cooperation. It also promotes the patient's autonomy. Assess for any potential barriers to communication, example, patient's age, language, and ability to speak, literacy level, ability to hear. So, sir, which one would you prefer to use?
Tagalog English Messiah.
Do you have any speaking disability by chance? Any problem with hearing? Okay, thank you. Effective and clear communication is essential to provide the best care possible for patients. Provided the client the opportunity to clarify, ask, or raise any concern. Sir, do you have any concerns to ask or clarify before we start the interview? Okay. If you have any concerns later, please don't hesitate to ask me later. Clarification is important in many situations, especially when what is being communicated is difficult in some way. ensure clients' comfort, privacy, and confidentiality. So, sir, are you comfortable in that position? Is there any something that you need? Does the room temperature is okay with you?
It's okay.
Okay. Providing the atmosphere that helps the patient feel at ease despite any physical discomforts, encourage the patients and help them to overcome the feelings that they are dislike or disappointed to or of. So, began the interview with an open-ended question and allowed for full freedom of response. Like, um, this is to further explore patient's data. So may I ask what is your full name, sir?
Peter Jr.
Your age?
20.
20. Where do you live?
Duran, City.
Date of birth?
August 23, 2003.
Place of birth?
General Santos City.
Marital status?
Single.
Gender?
Name.
um, Contact information?
09 46 567
Thank you. Nationality?
Filipino.
Religion?
Catholic.
Language do you speak?
Tagalog, Bisaya. English.
And education level.
College.
Okay. Reason for seeking care. What brought you to hospital today, sir?
My stomach ache.
Um, is- okay. Seems like bothering you. Um, can you tell me about more about it?
Um, I feel the pain if I mold. Yes, I mold.
Can you describe to me the pain that you are experiencing? Is it squeezing, stabbing, dull, twisting, or cramping?
Cramping and squeezing.
Alright. How long you have been having this pain, sir?
4 days.
Okay. Where actually the pain is that you are experiencing located? Can you point it out? Does it occur anywhere?
Only
Alright. How long is it usually last?
20 to 20 minutes, an hour.
Does it take the distractor?
Yes. Sometimes
How bad is it?
it's bad when it's super bad, but it can all properly.
About your pain on the scale of 1 to 10, 10 is being worse and 1 is no pain. How bad is your pain, sir?
8.
What do you do when your pain in the stomach triggers?
I put some heat pads to lessen the pain.
So does it help you to stomach?
Yes, it helps.
What are the factors that make your stomach pain worse?
When I eat greasy foods and carbonated drinks.
Do you let your food to be fully digest before doing anything?
No, and my habit are after I eat, I lay down in bed or I sit.
Alright. Do you take any medication, sir?
Yes, pyramid, Imodium, what the other, Victomol, what do you call that?
Pepto-Bismol?
Yes, Victomol.
Yes. Does it help you?
Yes.
Okay. Are there any symptoms along with your stomach pain?
No.
Okay. It must be hard for you. Okay. Does the pain in your stomach affect your daily activities?
Yes, especially my academics.
Oh, I see. How does it affect your studies?
I can go to my class on time because I can walk faster
Oh, okay.
because I feel the pain when I move.
Alright. Sir, I am going to ask about your past health history. Just answer the question as far as you remember. Okay? Have you had the same problem before?
No.
Do you have any childhood illnesses like dogs, whooping cough.
I have a chicken pox when I was in grade 8. When I was in grade 8, I was in a chicken pox.
Alright. Have you had your immunization vaccine recently?
Yes, as I can remember, back in 2019, I got my vaccination for COVID-19 and it was a Pfizer.
Alright. Have you ever been admitted to hospital, sir?
When I grew up, as far as I remember, no, maybe when I was a child, maybe.
Alright. Have you undergone surgery before?
No.
No. Have you been in incident before?
Yes, but um, not to like feel the pain like that, not go to hospital.
Minor pain, yeah. Okay. Do you have any allergies to food, allergies to drugs?
I have allergies on eating shrimp.
Just eat it, alright. Okay, Sir CJ, I'll be asking you questions about your family, health, histories of health problems are genetically based. It's important for us to know this because it might show clues about your current health status. Are you ready, sir?
Okay.
Do your parents have any genetic disease like diabetes, tuberculosis, or depression?
No, only the side of my mom. Diabetes.
Okay. How about your other relatives or any family?
Maybe they have I heard of my mom, they have a asthma.
Asthma. Okay. Someone with asthma or cancer?
As I told, my cousins has asthma.
Alright. Okay, Sir CJ, the next question are quite personal and it's up to you to answer or you choose not to answer, then I respect it. And I assure that the information will remain confidential. Okay. Is there anything at home that stresses you? Can you tell me about it?
The first problem is financially.
Okay.
Financial and stress and academics.
Stress and accounts. Okay. Okay, how do you manage your stress?
Usually I manage my stress by playing volleyball. It makes me more comfortable the lesson relieve my stress.
Alright. Um, do you have any eating disorder?
No.
Being eating, do you eat your meal on time? Do you eat enough food?
Yes.
Yes. Have you been in therapy before?
No.
No. How frequently do you see your friends?
Every day because we have a class.
Alright. Do you have a good relationship with others?
Yes.
Yes. I'll be asking about your current lifestyle. Would that be okay with you, sir? Alright. I'll be asking about your current lifestyle. Would that be okay? I suppose that you're a student. Am I right?
Yes.
What education level are you at now?
First week level.
Mm-hmm. Where's your college? How's college after? Are you doing well?
As for now, as a first year college, even if there's some basic demonstration, but we're doing well.
Do you smoke?
No.
No. Do you do any drugs?
No.
No. Do you drink alcohol?
No. Occasionally.
Alright. Do you exercise regularly?
Twice a week because we have a subject PE. So we're gonna perform some circuit training like that.
Okay. Are you sexually active, sir?
No.
No. What food do you usually eat on a particular day, like breakfast, lunch, snacks, or dinner?
In breakfast, milk and oats, and it's my routine. And sometimes in lunch, different types of foods like um, vegetables like that.
Alright.
Then in dinner, it's like sabaw, like watery foods like sabuno.
Okay. Then, summarize the information obtained during the working case. So we are about almost done. Please allow me to summarize and relate, state all the information that I have gathered during the session. Feel free to correct me if there is something wrong with the information.
Okay.
Okay. Your name is Peter Albacola, and you prefer language Bisaya and Tagalog. Alright. Do you have your name or age is country, where do you live, date of birth, almost, yeah, and gender and marital status. Alright. So, this is to ensure the validity and accuracy of the data that has obtained. Is there anything that you want to correct or any concern or
No.
any clarification?
I'm okay.
Alright. So, Sir Cater, we are done. I will give the data.
Okay.
I will give the data to the physician. Don't worry that. Rest assured that the information you give is only for the healthcare and medication staff and medical staff and will remain confidential. So, do you have any concern before we end this?
No.
Alright.
I'm okay.
We will just call you right away for any follow-up interview or test that you need to take. Thank you very much for your cooperation. Have a good day and take care. And that's all. Thank you.